Gentlemen, welcome to the monthly lecture series of the Royal Asiatic Society. Today we have Dr. Vimala Sena, Miss Dr. Vimala Vansa, MD, PhD, MBA, DSc, is a professor of medicine and endocrinology and nutrition, a former university professor, chief of endocrinology. He is a world-renowned expert in these areas, uh, in sort of endocrinology, osteoporosis, and metabolic bone disease, vitamin D, and nutrition. He holds numerous distinctions as an educator, an author, researcher, innovator, executive board member, and administrator and philanthropist. He was he was the first fully trained Sri Lankan clinical endocrinologist in 1982 and the first full professor of general medicine outside Sri Lanka. So we have extremely privileged to have Dr. Vimala Vansa with us. He studied at Ananda College, Colombo. He was quite a sportsman. He played for the college teams in hockey, soccer, badminton, basketball, and led the junior and senior cadet platoons. He obtained a medical degree from the University of Pennsylvania and 13 postgraduate degrees from the United Kingdom and the USA. He was also a consultant to the International Atomic Energy Authority in the late 1980s. He completed a diploma in medical administration at Johns Hopkins University Business College and earned an executive Master of Business Administration degree from Rutgers University School of Business. He's also served as a professor of physiology and integrative biology and pharmacology from the Graduate School of Biomedical Sciences in New Zealand. He's written several books, and he's also a retired Air Force squadron leader. So, I mean, he's almost, he's sort of so rounded in everything that he's been doing, and he's done it all perfectly. He was also, while at the university, he was president of the University and Sri Lanka Explorers Club. So we are, I think, extremely privileged to have somebody like Dr. Vimala Vansa to speak to us. Dr. Vimala Vansa, for example, will speak to us on understanding COVID-19, actions for mitigating risks, facts, and myths. Dr. Vimala Vansa is an MD, PhD, MBA, DSc, Director of Cardiometabolic Endocrine Institute, New Zealand, USA. Dr. Vimala Vansa, I give it over to you. Thank you.
Thank you, Mr. Ashley, the President of Royal Asiatic Society of Sri Lanka. And this is, in fact, the invited guest lecture for the annual scientific meeting, which was postponed due to the widespread the COVID-19 in Sri Lanka. So I'm glad that the RAS decided to reinitiate the lecture as a monthly meeting, and I'm very privileged and thank you for this kind invitation. So this the 1 hour or so, I'm going to present you, in fact, the 10 different topics related to coronavirus or COVID-19. The way I'm going to do that, actually, based on the questions, thousands of questions I received over the past several weeks on various aspects. So my presentation is really designed based on those questions, and also the issue of one of the article I published, or actually wrote in January 5th this year. Before this, all the ha-hu about the coronavirus. In fact, the 5th of January, I wrote that article, which was published on March 1st. In fact, in that, I predicted that in January 5th, by the way, and COVID-19 is going to be a pandemic, and it's going to have an economic chaos and the stock markets collapse. By the way, I do not have any conflict of interest as shown in this particular slide. So let's start with the very basics as introduction. Coronaviruses are a large family of viruses. There are thousands of them, in fact. The common reservoirs are being wild animals. Occasionally, and in fact very rarely, it can mutate the genes to transmit to humans. It's a very rare occurrence. In fact, the type of mutation occurs supposed to be occurring every few hundred years. So it's a very rare occurrence, thank God. So it causes the acute respiratory tract infections in humans. These range from the common cold, familiar with the influenza, to more severe diseases such as recently occurred in the Middle Eastern respiratory syndrome, MERS, as well as severe acute respiratory syndrome, so-called SARS, in the eastern region. Now, most recently, the COVID-19 is also causes the respiratory tract infection, causing havoc in the world. So this presented the schematic diagram of the COVID-19. It's from the CDC website. It's called corona. It's looking like a crown with the spikes coming out of the corona shell. This is indeed a very important part for attachment of the human cells to infect. So if you look at the cross-sectional view of the COVID-19, so it illustrates the internal structure. Again, it's a schematic view. The one in green is the one what you call the viral RNA genome, which has the capability of multiply exponentially and create millions of virome within our body cells. In addition, you can see these yellow spikes are the so-called proteins, which are essential for COVID to attach to the human cells. So let's look at how infectious the COVID-19 as a perspective, so that you can get an idea of rather than listen to all hype in the internet. It's approximately but 10 times deadlier than the common cold and influenza virus. I'll show some statistics in the next slide. However, it's 3 times less deadlier than the SARS and 10 times less deadly than the MERS viruses. So let's look at the annual death from common cold, the flu, influenza, in perspective again. The 95% of the deaths occur between November and April each year in the northern latitudes, northern countries, like during their winter season. In fact, in the United States, as per the CDC reports, between 30,000 and 50,000, mostly elderly people, are dying from influenza each winter season. So in the United Kingdom, it's between 8 to 15,000 people die each year. Again, vast majority are older people. So this slide I put to illustrate you how COVID-19 enter into the lung cells. So imagine that this is a cartoon version of the coronavirus. It has this spike of what you call a spike protein, S protein. That's what it communicates or attached to the human cells, but it needs to be cleaved by the enzyme to get that attachment stable. Now, it needs the 2 human protein to get attached properly. And perhaps you have not heard this one at all, but it's a really important protein, heparin sulfate proglycan. So coronavirus recognize that protein, and the initial attachment is through these millions of molecules of heparin sulfate glycan in our cell membranes. It is generic. But in pulmonary cells, so as the gastrointestinal and the mucosal cells, there is another very special receptor, what you call the S2 receptor. Remember that name, you're going to address that later. So presence of these two, the COVID can tightly bind to the cell membrane and then enable it to inject RNA or genetic material into the cell, starting replication. So in theory, antibody, if you raise antibody against these S2 receptors, it should be able to block COVID-19 entry into the human cells. However, in practice, it's impossible and in fact deadly. If you block the ACE2 receptors, we will not be able to survive. So that's a non-starter. Nevertheless, antibodies raised against COVID, various components, or convalescence antibodies from the people who recovered fully, or even engineered antibodies can be used to neutralize COVID-19 in severely affected people. So that could be a life-saving treatment uh, at these current stages, especially for those who are in ICU setup. Now, this is a slide from the Merck website I borrowed, and it's an electron microscopic appearance of COVID. So all these blue dots are COVID viruses, looking at 125,000 magnification inside these lung cells. So they multiply like mushroom, and with the critical stage, the cell dies and rupture, and the COVID viron, what called baby viruses, release into the local environment and reinfect locally or transfer to other sites via the bloodstream. Here I have summarized the clinical presentation of COVID-19 infection, again for general audience point of view, to give an idea of what to expect the person with COVID-19 infection. Most of them, as you see, has a cough. Either initially it's a dry cough, can become productive later, and majority has a high temperature, can go up to 105 degrees, and 101 to 105, body aches, tachycardia, which is a raised heart rate, dyspnea, difficulty in breathing, and indeed an important sign, which is gastrointestinal symptoms, as COVID can continue to shed through the gastrointestinal tract via stools for many, many days, even after the antigen become negative in the bloodstream. So it can be still infective through stools. As you notice that upper respiratory tract signs are very minimal. Let's move to the next part where we are looking at who's susceptible to develop COVID-19, and then look at some of the dangerous signs of COVID-19 so that you can recognize and tell your friends or neighbors with those signs to contact the health authorities immediately. It's important to realize that people at all ages can get infected with COVID-19. Nobody is immune to get infected with COVID-19. However, as I showed you later, people with good immune systems may not even know that they're getting infected. So and especially they do not develop serious side effects, and hardly anybody with a good immune system dies, other than they have the multiple other comorbidities. So this is one of the problems also. People, 50 to 70% of people getting the disease, especially youngsters, they may not know they have the disease, but they are carriers and they are in the community spreading the disease to other people. So that's how the secondary and tertiary peaks occur in community when the governments and the health department are totally rely on the hospital testing alone, as happening in Sri Lanka. They completely neglect what's happening in the community, as in India and few other countries. So people who are most liable to get the problem is older people with the pre-existing medical conditions such as diabetes, hypertension, and chronic heart and lung diseases, any chronic diseases. They are the one who is the most liable to develop severe complication needing ICU, and indeed age 80 and above, almost 20 to 25% of the people die from this particular disease. So people of all age should take steps to protect themselves. By protecting themselves, they also can protect the others by not transmitting the virus to them, by doing simple things like respiratory hygiene and hand hygiene to start with. This is, of course, in addition to wearing face masks in public. I put this slide together to show you the age-related mortality rates from COVID-19. And this is not a straightforward from one paper. It's construct from multiple sources put together so that you understand the relationship between the age in this x-axis and the age-specific mortality on the y-axis. As to see, as the patients or people become advanced, the rate of mortality and the severity exponentially increases. In fact, people aged between about 80 responsible for the 80% of all deaths due to COVID-19. So this is a specific group, one we should protect, but very, very few countries taking effort to actually educating the public how to protect our seniors, elders, grandmothers, grandparents, uncles, and aunties, as well as the teachers, as our religious leaders. So why should you worry about coronavirus? Approximately 80% of the people, when they had the COVID illness, they don't know even. It's such a mild problem, just like having a common cold, and they recovered and they get back to work. Yet, during that period, they are infectious to others. Only in less than 10% of the people with the COVID causes serious illness. It is therefore normal for people to worry and about the COVID-19, but there's no reason to get panicked. This is a little more severe than the common cold and the flu that kills thousands of people annually. But if you take the proper precaution and improve your immunity, the chance of getting into trouble is you can reduce significantly. Basically, one needs to follow up with the local health authorities' advice, assuming that they're telling the right things, and include the travel restriction, movement, and restriction of gatherings. So, public health guidelines are exceptionally simple. No handshaking. Read by means can say "Aiboan" or whatever the cultural appropriate way to doing that without handshaking and transmitting viruses. So what are the dangerous signs of COVID-19? So the issue is that unlike SARS and MERS, in addition to pulmonary, also called lung tissue disease, COVID-19 also affects the heart and the entire vascular system. For example, COVID-19 causes myocarditis and heart failure. That can cause death, not necessarily the lungs itself. Similarly, it causes the endothelial cells, the covering of the vascular system, significantly affected, and it can produce microemboli leading to pulmonary thrombosis and leading to death. These are different ways of dying from COVID-19 other than the well-known lung failure. So pulmonary and cardiovascular effects make existing other chronic diseases worse. So they can die from other diseases which get worse by hypoxia secondary to lung failure. As I said, it causes the endothelial cell damage, and that causes the microthrombi and embolism, especially to the lungs, making the situation much worse. So here are the list of dangerous signs of COVID-19. So before going to the list, so most die from the thing called hyperimmune syndrome, what we call in shortly HLH, initiated by the virus. That causes so-called cytokine storm. It produces the 1,000-fold higher amount of inflammatory chemicals from our own bodies, which unfortunately start attacking our own normal cells. So that's what called this hyperimmune syndrome. So that leads to acute respiratory distress syndrome, and you may have heard the thing called ARDS, pulmonary edema, blood clots, and diffuse pneumonia. Patient can die from any of these. In most cases, the combination of these things. Eventually, the cause of death is hypoxia, the lack of oxygen. So many of them die from the combination of the lung and heart failure due to oxygen insufficiency. Whereas a vitamin D deficiency and associated weaker immune system markedly increase the complication and death rate. If you look at the recently emerging statistics worldwide, the people who are in intensive care units and people who are dying, 95% of them has a significantly or very, very low serum vitamin D level. So they have a low vitamin D and thereby very low immune system, very poor immune system, so that they are unable to fight against COVID to win. So here are the warning signs. So if you notice any one of them, no need to have a combination. You need to contact the local health authority get some telephonic consultation. Difficulty in breathing or shortness of breath, especially it's something new you never had. I had 3 or 4 friends who got infected in London, UK, for example. They had only shortness of breath, which they never had. Couldn't even walk for about 50 meters. So they called the health authority, went in, and they found COVID positive. High fever, associated body aches, persistent pain and pressure in the chest, just like having a heart attack. Recently induced confusion, sleepiness, inability to RASSL. What all are due to hypoxia, low oxygen in blood. So anybody having a fever, tiredness, continuous cough, body ache, and difficulty in breathing specifically, one need to get in touch with the emergency hotline or call the nearest hospital to get further advice. Waiting at home at this stage, it could be can lead to death. So in the next part, I'm going to go through a few of the myths related to COVID-19. I have seen 500 to 1,000 this kind of myths circulating in the internet and viral videos, and nothing whatsoever to reality with COVID-19. So let's look at a handful of them and see what is true, what is not. Here's a fact. COVID-19 infects the lower respiratory tract. This is not an upper respiratory tract infection like common cold or influenza. They're very different. Primarily, it's an airborne disease. This is despite of the misleading information by the WHO and some other health authorities that it does not spread with the airborne disease. This is absolutely not true. In my opinion, and the data available, but 70% of the disease actually occurs through the airborne route. Therefore, wearing a mask is essential. If anybody, including the head of health department or whatever, saying that mask is not necessary, that is insane. That person needs to get back to school to learn basic preventive medicine. It also goes through microdroplets when an infected person coughs or sneezes. So again, wearing a mask will be very helpful for them to infect other people. It can also infect through saliva, any discharge, body discharge, and indeed we are through stools. For example, it has been shown that for somebody with the COVID, after going to the toilet, during flushing the toilet, it can spread up to 6 to 8 feet up in the air. So the flushing must be done when the lid is closed. That's an important thing to notice. So COVID-19 can enter the human body via any mucous membrane. I will show that example next slide, but it does not transmit through, luckily, mosquito bites. Otherwise, the tropical countries will be doomed by now. And also, there's no evidence that there's any domestic animals spreading the disease yet. So here are some of the examples of mucous membranes: eyes, nose, mouth, buccal mucosa, genitoanal region. So you should not touch any of this area without thoroughly washing hands, because you can self-transfer the virus to this to yourself. And in fact, the mouth is important because there have been several cases now. The couples, or not couple, I mean, kissing has been the route of transmission from one person to other through mouth. I'm going to show this small 15-second clip just to illustrate one such mistake, especially consider the last 5 seconds of this video.
Hello.
I
Something
hope
went
that you
wrong.
saw that person licking his fingers just after saying that not to do so. Anyway, it's another set of facts. The cold or hot weather condition by themselves will not kill COVID-19. They are relatively temperature insensitive. In the cold and freezing, including the refrigerator and the freezers, it can last for a month or more. It will not kill the virus. Direct exposure to sunlight over a longer period can reduce its activity, but not necessarily killing it. Whereas daily exposure to the skin to late morning sunlight reduce the risk of the individual by improving vitamin D status. These are facts. So let's look at some myths as well. Drinking hot liquid, alcohol, inhaling hot air, or anything else to raise the body temperature or alcohol absolutely will not kill the virus. There are a lot of viral videos going on to show this is a myth, and people actually had died by trying to raise their body temperature by listening to this crap in the internet. So attempt to increase internal body temperature while having the disease will only ask for more trouble and expedite the death. So please don't do it. And similarly, there's no evidence that any herbal preparation is capable of killing the virus. Absolutely none, no data. So washing hands thoroughly will eliminate the viruses attached to hands and thereby preventing self-infection and also infecting others by touching other people like children, for example. Coronaviruses can stay on surfaces for a few hours to a few days, depending on the type of surface. If you're worried that surface may be contaminated because you brought some grocery bag and you put on the table, pretty easy. Use a disinfectant, any, or alcohol-based wipes to clean the surface and let it dry. That's enough to damage the COVID virus. Drinking alcohol and smoke, I told you, will not help control COVID. In fact, actually, it can expedite the complication and death. So don't use alcohol and COVID unless you want to make it worse. Many people have asked me whether the antibiotics work against coronavirus. Absolutely no. Antibiotics do not work against viruses. COVID-19 is not a bacteria, therefore there's no role of antibiotics in controlling COVID-19. So antibiotics do not work. Antibiotics should not be used as a means of prevention or treatment of COVID-19, period. Hospitals, they might use it if they suspect a coexisting bacterial infection. So the advice is haphazard antibiotic treatment is not recommended and can be harmful. What are the other basic facts and the effective ways of protecting self and the family against coronaviruses? Indeed, number one, it's the use of face masks whenever getting out of the home or workplace. Keep the social distance. This is not 1 to 2 meters as said by the WHO, which is in fact wrong. Because we know now by various scientific methods and the closed circuit TV studies on infection, how the infection occurs. In a closed room, the virus can spread up to 20 to 30 feet away by floating in the air and inhaling by the people within that closed environment. This is not the case when you're going out to the open air. So avoid crowded situation. Frequently washing hands with soap and water and alcohol-based hand rub can certainly reduce infection. So the other things people have asked is the use of the ultraviolet lamps to kill COVID-19. Answer is absolutely no. The limited exposure to UVA and ultraviolet B do not kill COVID-19 because the envelope is strong enough that UVA and UVB will not penetrate into the COVID internal RNA system. So ultraviolet lamp should not be used to sterilize hands or other area of the skin, as UV radiation can cause skin irritation. If it's used in the face, it can damage the eyes and the vision, and the benefits are almost nothing. However, there's a one UV rays which can be helpful. It's called the far UVC rays. This is the frequency between 202 and 222 nanometers. That will kill most microbes quickly. Unfortunately, the sunlight reaching the Earth's surface do not have any UVC rays. They're all, or nearly 100% of them are filtered by the stratosphere. So we do not get any UVC rays coming into the Earth's surface. Nevertheless, UVC lamps and the wands are actually available in the market and has been available for at least 10 to 12 years for anybody interested to purchase. Let's look at the alcohol myth. The regular spraying or rubbing alcohol or even the chlorine in the skin, while it certainly can harm the COVID, it can also harm the people, damage the skin, clothes, mucous membrane, and it can be in fact toxic. So don't use any of this rubbing alcohol and chlorine and any disinfectant on skin surfaces. It will not kill viruses that's already entered into the body. So the other question people ask, people celebrate in the social media is rinsing nose and saltwater gargling. None of them actually has any effect whatsoever on COVID-19. So since this presentation will be in the YouTube soon, I'm not going to go through the slides so that I need to cover a lot of things, but you can see these slides leisurely by stopping the YouTube at any time you want. Therefore, I'm going to skip some of these fairly quickly. So basically, rinsing the nose, gargling salt water may be good for common cold and sore throat, but certainly not for COVID-19. No effect. Consuming herbs. There's only one herb has been shown to have some effect, which is the curcumin. Other than that, there's absolutely no evidence whatsoever any herbal or herbal patches, as some people are advertising in the internet, has any effect of controlling COVID-19. Don't spend money on a placebo treatment. So if you need information, make sure that go to credible websites such as the Center for Disease Control, National Institute of Health, and a handful of few other sites. And most of the other sites, they're creating their own fake news. In fact, unfortunately, some of the health departments of the different countries also providing the significantly inaccurate information for their public. So we have to be careful what to read and what to understand on the correct information. So another myth is that can the thermal cameras, what they use in the TVs and nowadays in the shops and the government centers, everybody uses these thermal things to detect. They think that they're detecting COVID. Absolutely not. Simply see whether somebody has a little temperature or not. If you walk in the hot sunshine and enter into one of these buildings, your temperature could be 101. So you will be segregated for no reason. So I don't think this is a good way of controlling or helping people at all. In fact, the people with COVID may not develop any temperature or symptoms up to 2 to 10 days before getting any symptom. So during this period, they can happily enter into any of these buildings, the airports, and infect other people. So what's the use of this, the gimmicks of using the thermal camera? It's another question a lot of people have asked, that whether it's safe to receive a package from China or some other place with the COVID infection. Answer is generally the yes. The chance of getting contaminated by the time you receive the package from COVID is exceptionally rare, probably 1 in 100,000 or less. So there's hardly any chance that COVID survived with this transportation system for that long. Let's move to the next part to see what other steps you can take to prevent COVID-19 spread to yourself and your loved ones. One thing people have greatly neglected is the most vulnerable group, which is the older people acquiring COVID-19 from a younger generation who come to visit them. And if they get the disease, as I said, that their death rates could be anything up to 20 to 30%. So 1 in 3 can die from COVID in this circumstance. If you look at the death rate in United States, for example, the almost 40 to 45% of the deaths in United States, again, virtually nobody think about this one, are actually the deaths occurring in the nursing homes and the disability centers. So these old folks are dying very easily because their immune system is probably not functioning altogether, being indoors the whole period. And the visitors coming, children and other people, bring the disease and they play with their dads and moms and whoever and go home. But unfortunately, these old folks get the disease also from the people who work in these nursing homes and the disability center. So the death rate in these centers had been high as a 40 to 50% in some centers. So if you look at the entire death rate in US, close to 40% are due to deaths from these highly vulnerable group of seniors and the disabled people. So as I said before, children and young adults can be COVID carriers. They may not have any symptoms whatsoever, but they can spread the disease. So think about it, how to protect the elderly from children also. Then in this particular critical period, it's best to avoid visiting personally, but that doesn't mean that you should isolate the seniors or the grandparents. They can talk to them several times a day, use the social media, telephone, and some other means to keep them busy and talking to them. Same with the delivery of the food, and only the essential people should visit these folks, and in many circumstances they actually leave the food outside, knock at the door, and they leave. So let's come back to the nitty-gritty stuff for the respiratory mask to wear or not. In my opinion, and the opinion of the most experts in the world, is mask is a must. I know that a handful of people still boasting that there's no need to wearing a mask. I don't know why or how they get that information. Mask is a must, even this post-curfew period, to when you get out in the crowd and getting out of the home and until you come back home. And make sure that you wear good mask in confined spaces, such as in buses, taxis, and especially during air travel. Those who are frequently in contact with the public, including the hospital staff, they must wear a mask like N95 mask that I wore during my flight from London to Heathrow to protect myself. I did not take it out until you get down from at Karnataka. Similarly, wearing a N95 protective mask is also important when you're visiting places, visiting people, to protect, not only protect yourself, but also protect other people. Wash your hands thoroughly in soap and water. Stay away from the sick. And more importantly, if you are sick, stay at home and do not give viruses to other people. Use tissues to cough and use your elbow when you are coughing if you have to, and avoid touching face, eyes, nose, mouth, as we discussed before. If you are not well, stay at home. But by day 6, day 7, you are still having high temperature, time to call the nearest hospital or use the hotline. So let's look at one of the brief presentations from the World Health Organization to get a few things of what they say.
Yeah, I do not hear anything right now. At least for 10 minutes, I have not been hearing anything.
So it's correct to say that the information has been changing virtually every week. So let's look at the essential public health measures that, and some of the medicines can be used for COVID-19. So social distancing, specifically staying at home, is a good thing if you can. Frequently washing hands with soap and water, which we discussed, and following proper respiratory hygiene. Soaking fruits and vegetables in the water containing soap will release the coronaviruses, actually damage the coronavirus, and you can wash them off with the running water before use. Not many people are using that. What are the other public health steps? So you should be worried about containers, and when you keep bags on the floor, that if hands can catch virus, why not bags and the containers? They are even bigger, so they can actually bring more order of magnitude more viruses than bringing you through the hands and viruses. So discontaminating them is not a bad idea. Before you bring the containers or the shopping bags inside your kitchen, leave them outside or rub them with the alcohol-based thing to get rid of these virus particles. So basically what you can do best is to boost your immunity using natural means, such as improving vitamin D status, physical activity, relaxation, balanced diet, and indeed meditation. So let's look at what's the goal of social distancing. Everybody talk about it, but most people doesn't understand what's that for. So together it works with the hand washing and all the respiratory hygiene together. But the goal is to reduce the burden on healthcare workers and hospitals by flattening the peak. It's not necessary from infecting one to the other, but the goal of social distancing is to flattening the peak. So what is this flattening the peak mantra? So I created this cartoon based on the number of publications available to illustrate this so-called flattening of the peak. So let me explain that briefly. So in outbreaks, you can see the large number of people getting infected. It can be hundreds, could be thousands, like in US and UK and Italy. And then it gradually goes away. And with this peak of very high incidences, hospitals become burdened, and in fact, ICU beds and other facilities might be overfilled and cause a tremendous issue for patient safety, as well as hospital staff safety. So what you're doing in public health is try and flatten this peak into a manageable area. So even though in these circumstances, the area under the curve is the green one or the red one, still could be the same. In other words, the number of people affected in the green and red could be same or maybe a little less with the red, but then the hospitals are able to manage their workload very easily with this flattened peak. Social distance is really is to flatten the peak and nothing else. So let's look at very briefly the treatment aspects of what's available for COVID-19. So today there's no specific medicine available or can be specifically recommendable to prevent or treat COVID-19. There is in fact only one drug that can prevent and treat, which is hydroxychloroquine, which in most tropical countries, the doctors and healthcare workers are very familiar with this particular drug, either chloroquine or hydroxychloroquine that we have been using for decades for treating and as a prophylactic for malaria. There is a rare complication of using hydroxychloroquine, which is called prolonged QT syndrome, which many doctors are exaggerating dramatically to, I don't know why, saying that it's a very important thing, therefore has to be given in the hospital, which is basically nonsense. And in the incidence of QT syndrome is very rare, something like 1 in 5,000, 1 in 10,000. So you don't need to be that careful to administer hydroxychloroquine, even in the outpatient setup, rather than restricting to hospital, which I think is an erroneous conclusion by somebody. Similarly, there are many empiric therapies and vaccines are under investigation and in clinical trials. So let's have a look at it with them. So I already said that hydroxychloroquine is effective in entering the virus into the cells, as well as actually preventing the replication of the virus within the pulmonary cells. However, it needs to work with the trace element, particularly the zinc atom. So in the absence of zinc, chloroquine actions are somewhat suppressed. So chloroquine and zinc can be used for both primary prevention and treatment, as well as reduce the complications of COVID. Another fancy drug, antiviral agent, has come up, actually approved by the FDA now for remdesivir, which is very expensive and has a very little effect, actually, if you look at the real controlled clinical data. It is promoted by the governments, big pharma, and indeed some doctors blindly without knowing what they're promoting to make big profit at the expense of the public. Whereas vitamin D and other immune mediators like lactoferrin are very economical and freely available and very much more effective than all the other remedies put together against COVID-19. I'm repeating that. These two agents are actually more potent and more effective than every other agent in the market put together, especially in the combination of vitamin D, lactoferrin, and zinc carbonate or gluconase preparation for the prevention of complication and improving the immunity. So here are some of the partial list of the currently drugs under investigation. I'm not going to read it again. If you're interested, you can go back to the YouTube and see the mechanism actions and everything's in this particular slide. And you can, and I put this, the jungle of medications that currently being tested in clinical trials against the so-called standard clinical care as a control. In fact, I think it should be controlled. The control should be hydroxychloroquine and not the standard clinical care by giving nothing. So any of these drugs, in my opinion, should be compared with hydroxychloroquine and zinc together to see whether they are more effective than any of all these drugs and whether they have the less side effects. Are there any vaccines against coronavirus? It's a question everybody wants to know. No, none at the moment. And my opinion, highly unlikely there will be an effective vaccine either. Now, not even in the future. When some is available, the COVID infection is by that time will be over. We're talking about the next year. Today, there have been no effective vaccine for any coronavirus, never mind COVID-19. None we have got it. In other words, scientists and the companies have completely failed to develop an effective, safe, and affordable vaccine for any coronavirus. So why now for COVID-19? So yeah, another question people have asked me multiple times, when you get the vaccination against the pneumonia, for example, pneumococcal vaccine, whether that prevents getting COVID-19. Unfortunately, it's not. There's no cross protection from any other respiratory vaccines, viral vaccines against viruses. So although these vaccines are not effective against the COVID-19, some of these effective vaccines could be helpful to prevent superinfection with these other respiratory viruses. Nevertheless, there's some evidence, I won't say 100% available, but the BCG vaccination, people in the Asian countries like Sri Lanka, India, they used to have BCG vaccine routinely. Everybody got that against TB, and may reduce the length of the illness of COVID-19 by stimulating the so-called memory cells in the body to produce antibodies a little faster, but it's not a protection against COVID-19. So in this part, we are going to talk about what we should do and not do during the current COVID-19 pandemic. So let's start with the things that you should not do. So the following measures are not useful or in fact ineffective or even harmful to you. Smoking and drinking, wearing multiple masks, increasing body temperature, and taking antibiotics and anti-inflammatory drugs. Those all can be somewhat harmful. Similarly, taking any new medication you should not attempt unless without the medical advices. This including the taking antibiotics, corticosteroids, and strong anti-inflammatory agents. Whereas taking paracetamol in West is called Tylenol, is a safer and probably cheaper to use when appropriate for temperature reduction and for body aches. So most important thing is to, when you have this temperature or feel like you're having COVID-19, it's important to keep hydrated with drinks, water, tea, and properly ventilated to oxygenation. One of the key things happening these days is people are using the same face mask, especially the sophisticated one, including N95 mask. If you use more than a certain number of hours, it can get clogged. Remember that this effective face mask has a very, very small holes, like a 0.5 angstrom kind of probe, so that it prevents the viruses getting in, so as a dust will remain on the surface of the mask. So this 500,000 or million holes in this face mask can get blocked. And thereby, if used continuously, it can prevent the oxygen getting into you, and people can develop hypoxia, difficulty in breathing, dizziness, and in fact, faintishness. So be careful of using these masks without cleaning up regularly. So avoiding getting the crowded place, these are very common sense approaches, but so as not sharing masks or shaking hands, avoiding social visit, chat, face-to-face contact, but you can use social media for your conferences and social conditioning. So when you follow up all these things, it will reduce the risk of infection, and indeed you get it, reduce the complication. So if you have a COVID-like symptoms, make sure that you share your medical history and most importantly, the travel history and exposure, if any, with your healthcare providers promptly without hiding anything. So what can we use with the available resources currently to reduce the risk from COVID-19 pandemic? So one of the things I'm going to discuss now in a bit more detail is the vitamin D, which is free available from the sunshine, and if you want to purchase, it's one of the cheapest medication available in most countries. Vitamin D, in fact, is not a medication; it's a natural vitamin in the body. Is converted to a very potent hormonal form. So the issue is that during the winter months in northern latitudes, respiratory viral diseases, as we discussed before, is affecting millions of people. So during the winter period, vitamin D concentration in blood in these people become low and become deficient. So immunity goes down and the respiratory viruses multiply very happily in that circumstances. In fact, I'll show the next slide. The flu season coincide very well with the winter time. If you look at the different types of viruses, I say that here, enterovirus, here's the coronavirus, they all coincide with the winter period that start from November, ending up in end of April. You can see that they are all restricted to respiratory virus diseases are restricted to this winter period when there's no sunshine or less sunshine, low vitamin D status, low immunity, and thereby increasing susceptibility to infection. It's a little bit complicated slide, but it will prove my point. What you're looking at is years, or the number of months here. Top panel, look at the PTH, parathyroid hormone. Lower panel is a 25-hydroxy vitamin D level in serum. So if you look at the pattern, during the summer months, your vitamin D increases. During winter months, vitamin D decreases. There have been thousands of publications showing this exactly the same thing in the northern latitudes during winter period. So coincide with that, when the vitamin D is low, your PTH level goes up. Actually, it increases the bone turnover, causing weaker bones. Another negative thing. But importantly, it can be used as a marker for immunity itself. The vitamin D is low, your immune system is low. can see that with it's a purple bar, that's where the normal range is. They're supposed to be there. But you can see that during the winter period, all of them having very much lower than the normal level of vitamin D. So no wonder these people are getting more infected with the respiratory viruses during the winter period. So why during this winter period the vitamin D is so low? Firstly, food has very little vitamin D except for mushrooms, unexposed mushroom, and fatty fish like mackerel and salmon. Other food has very, very little vitamin D. So we expect to get vitamin D free from sunshine, but we don't. We're not getting enough exposure to sunshine. Just because sunlight is there in tropical countries, that doesn't mean you are getting vitamin D. In fact, most of the data coming from tropical countries like India, Pakistan, Singapore, Malaysia, all these countries have shown that almost like a 65 to 70% of their population is vitamin D deficient throughout the year, despite 340 days of sunshine. So we are not getting exposure to sunlight appropriately. Secondly, during the winter period, the sunlight receiving this northern latitude comes at an angle, higher angle, what you call zenith angle. It does not have the capacity to penetrate the skin. In any case, the UV rays reaching the Earth's surface during winter months is minuscule. It's filtered out. So even if you stay in 2 hours in the sunshine, you may not get any vitamin D form in the skin. So this cartoon from Vitamin D Wiki summarizes one of the couple of reasons why we have a vitamin D deficiency, a pandemic in fact, coming down from 1970s to 2020. Less sun exposure, less in food, and less cofactors to build up our immune system. Collectively, it causes vitamin D deficiency and immune deficiency. This is a slide I put together about 4 years ago to illustrate how the evaluation we ended up with this mess, causing vulnerability to high infection. We used to run around in the sunshine, with adequate exposure to sunlight, generate vitamin D levels. In fact, we know by the studies done in Africa and the people running around, the normal vitamin D levels in the range of 50 nanograms per mil in these people. Right now, in most of people here in Sri Lanka and other people, we're talking about the 15 to 20 nanograms per mil range, whereas it's supposed to be 40 plus. You can generate your vitamin D adequacy over 40 nanograms by taking vitamin D daily, in this case 7,000 international units daily. It takes about 6-7 weeks to reach that level. So if you are in the peak of COVID, if you are going to take even 7,000 a day, the disease has come and gone by the time you reach therapeutic level. So it's not a real good option to in an emergency situation, taking daily smaller dose to achieve that. Whereas if you take the 50,000 units every other week, or the level fluctuates, you can actually maintain the level in a shorter period. I'll also illustrate a bit later to achieve the same thing in a better or the easy way. So how effective the vitamin D in viral diseases? There have been many studies showing that respiratory viral diseases subdue when you have the reasonable level of vitamin D, such as herpes zoster, Epstein-Barr virus, hepatitis, Ebola. Yeah, I worked some time back. HIV, dengue, measles, and even mumps. The severity will become less with the higher vitamin D level. So this is what happened when the intracellular vitamin D is able to control the viral disease by preventing viral replication and preventing the respiratory distress syndrome and indeed death. So winter season, that is vitamin D deficiency, respiratory viral infections, then you get the acute respiratory distress syndrome and death of mostly older people. So it's a vicious cycle that we can prevent by improving the vitamin D status very cost effectively. So in addition, there are multiple supporting evidence suggests there are other benefits of vitamin D. This includes the reduction of the risk of Alzheimer's disease, Parkinson's, vascular dementia, autoimmune diseases, and metabolic and variety of neurological disorders. So about 20 nanograms per ml is certainly adequate for risk reduction of musculoskeletal and upper respiratory tract infection, but nothing else. Nevertheless, about 30 nanograms per ml, which is a normal range what we considered, is necessary to reduce the risk of type 2 diabetes, obesity, metabolic syndrome, general infection, as well as reduction of the adverse pregnancy and birth outcomes. It's a very, very important area. However, in the conditions like now with the pandemic, one need to contain the level above 40 nanograms per ml, necessary to reduce the risk of autoimmune, not only autoimmune disorders, but also cancer, COVID-19, and to reduce what we call all-cause mortality. So how can we mitigate using existing agents? And I'm also showing you a little bit more deeper into the system, showing the mechanism of action of some of these agents. So I'm going to discuss the calcitriol, which is the active vitamin D hormone, angiotensin converting enzyme called ACE inhibitors, some of you may be taking, and angiotensin receptor blockers, ARB. So for example, in the US, combination of ACE and ARB are taken by about 65 million people. Worldwide, more than 680 million people are taking these two drugs. And I'll show you that these two drugs actually could be beneficial for prevention and the complication of COVID-19. That doesn't mean I'm advocating to start this medication for anyone who's not taking. But what I'm saying that people are already taking this for hypertension and renal protection. You should not stop this medication. This could be life-saving for those people. So let's focus on the vitamin D and angiotensin inhibitors to control COVID-19. So here's a cartoon format of a mechanism causing death by coronavirus. Firstly, it's entered into the body through any mucous membrane or gastrointestinal tract or through the pulmonary cells. So if you consider the pulmonary cells, there are millions of ACE2 receptors, which I've mentioned at the beginning of this presentation, through which coronavirus actually enter into the pulmonary cells. It produces LPS and lung injury part of that, and also it increases the hormonal system called renin angiotensin system. This is an essential hormonal system to control our day-to-day or minute-to-minute blood pressure. So in addition, this lipopolysaccharide things called the pulmonary hypertension and swelling of lungs, reducing the oxygenation of blood. And I mentioned that before, the generation of cytokine storm, which lead to acute respiratory distress syndrome and death due to subsequent cause. So how this cycle of death fits with what we know about these medications. Before I jump into that, I want to take you back to the basic endocrinology of active vitamin D. It's called 1,25-dihydroxyvitamin D, which is the same as calcitriol. So it controls the synthesis and release of the enzyme renin. It's in the kidneys. So renin is the one producer the cleaved angiotensinogen 2 is a large protein into angiotensin 1 and the potent form angiotensin 2 through angiotensin converting enzyme ACE. So people take these ACE inhibitors to prevent angiotensin 2 to convert into angiotensin 3. Simple as that. So in the absence of 1,25 vitamin D, there's more renin, more angiotensin 2 produced, increases the blood pressure, increases the extravascular tissue. But when you have enough vitamin D, it controls the system, reducing the blood pressure, reducing the extravascular volume, and maintaining the blood pressure very well. So that's how these things work. So angiotensin receptor blockers, again, it's a very common drug to use, which prevent the angiotensin 2. It's a very, very potent vasoconstrictor, stimulating the angiotensin receptors. So that's how this hormonal system works. So what happened with the vitamin D deficiency to this system? So when there's no vitamin D, enzyme renin will go up synthesis. It produces more and more angiotensin 2, angiotensin 2, and it binds to these receptors and increasing the blood pressure, causes pulmonary hypertension and increasing chronic pulmonary disease, thereby causing increased comorbidities and death by itself, even without the coronavirus. So vitamin deficiency increase comorbidities and other health disorders. What happened when the coronavirus come when the people with vitamin D deficiency? So it can have multiple effects. Firstly, it also enhances the synthesis of renin, therefore accelerate this axis, increase the pulmonary hypertension, and vitamin D effects on blocking the ACE activity is not there anymore. Therefore, the coronavirus can actually directly causes acute respiratory distress syndrome through hyperactivation in this renin-angiotensin hormonal system. So, to summarize that again, in the presence of coronaviruses, it blocks the ACE2 enzyme. Therefore, this axis from renin to generate the angiotensin 2 intensified and produce a large quantity of angiotensin 2, stimulate this system to produce pulmonary hypertension, reduce oxygenation of the blood, develop acute respiratory distress syndrome through cytokine storm, and pulmonary edema leading to death. So this is how the angiotensin causes a cytokine storm, acute respiratory distress syndrome, and indeed expediting the death. So let's put this together into the first cartoon which I discussed with you on the concept of death due to coronavirus. So once the coronavirus entered into the system, the pulmonary system, vitamin D can actually block the entrance of coronavirus. Similarly, it also blocks the ACE2 receptors activating and bringing down the nucleotides of the virus into the cell and activating these LPS and other things. In addition, the two drugs which I mentioned, ACE inhibitors and angiotensin receptor blocker agents, can block the system at this particular stage of the renin-angiotensin system, thereby minimizing or reducing the pulmonary hypertension, stop acute respiratory distress syndrome, and thereby reduce death. So there are multiple ways we can intervene this cycle of death, even in the absence of very potent and expensive and antiviral medication and lack of, in the absence of vaccine. So to look at a different way of the entire system work, the coronavirus here, if you have the vaccine, it's good, but as I said, it's unlikely that there'll be a good vaccine coming in the near future. And you can have the antiviral therapies, as you show in the yellow color. And nevertheless, this viral stuff is actually weakening the immune system, diffuse pneumonia, respiratory distress syndrome, and death. So we can intervene by the various other means in addition to vitamin D system. You can use the zinc oxide nanoparticle system. This is another approach soon becoming going to be available. So as a pegylated zinc oxide nanoparticle, which can reduce significantly reduce the pulmonary effects of COVID-19. So eventually, if you have the right approach, the people even at the ICU should be able to recover with a full recovery without going through the cycle of death. So I'm going to the last two parts now. How much vitamin D needed and what serum 24-hydroxy vitamin D concentration needed to achieve to protect yourself or we from COVID-19. So it's important to realize that taking smaller doses such as 400, 1,000 or 20 to 2,000 units per day, that's a standard dose in most countries, will have little or no effect on those who are having vitamin D insufficiency or deficiency. Taking these doses might take 2 to 4 years to build up your vitamin D level and immunity. So you can see that giving these pediatric or minuscule doses will not even touch what we need for controlling coronavirus. It needs larger doses, like show in the next slide. So, as I said, almost everyone is susceptible to get COVID-19, including the newborn to those who are above 100 years old. However, those with the vitamin D adequacy levels more than 40 nanograms per ml, for example, may not even develop any clinical symptomatology of COVID-19, but they do get this disease, but they overcome the disease very quickly due to rapid development of neutralizing antibodies. Those with vitamin D deficiency are the ones who develop complications, admitted to ICUs, and indeed 95% of the people will die. So it's such a simple concept to realize that if you supplement with the vitamin D adequately in the higher doses, what I call the mega dose treatment, you can prevent these death complications cycle. It costs less than $5 to $6 per person to prevent their deaths. So to fill up this, the vitamin D deficiency or the body's thought, they need thousands of units. I'm talking about 100,000 to 600,000 of units of vitamin D to bring down the serum level and maintain above 40 nanograms per ml, at least during this COVID pandemic for the next few months. So there are several ways of achieving this vitamin D sufficiency. One is the cheapest, is no cost. Exposed to summer-like sunlight between 10 a.m. and noon. Preferably, head and eyes are covered from direct sunlight because it damages the facial skin and eyes. Exposure to 30 to 6 minutes each day. This can be intermittently, 10 minutes into 3 or 4 times a day, with a third of the body exposed to direct sunlight. That can generate anything from 3,000 to about 7,000 units of vitamin D on a regular basis, whether there's COVID or no COVID. The daily supplementation of about 4,000 to 6,000, as I showed in the previous slide, is another way, but that's going to take a long time to develop the sufficiency stages. Therefore, taking 50,000 units capsules, which is available, were taken 2 or 3 times a week for the first couple of weeks, and then once a week for the next 10 to 20 weeks as appropriately, should definitely reduce the risk from COVID-19. Nevertheless, in emergency situation as currently for the past few weeks and weeks to come, with the next peak of COVID coming in June, there need to be a rapid boost of the immune system. To do that, one need to consume between 200 to 600,000 units of vitamin D, either at a simultaneously or maybe every other day or daily basis, the smaller doses, or a week or so, to build up the immune system rapidly. In fact, the studies have shown that this can happen within 3 days of taking such a large dose of vitamin D. The goal is to achieve and maintain the serum 25-hydroxyvitamin D concentration above 14 nanograms per ml. Now, measurements of 25-hydroxyvitamin D concentration is only measurements needed. You do not need any other fancy measurement that are only additional, adding cost to the testing. So, irrespective of the regime used, one need to maintain between 2,000 to 4,000 units on a daily basis. Once this the initial loading dose is completed to maintain the serum levels. So, let's look at my last section, which is I think probably the most important. The reason for the reported incomparatively low COVID-19 statistics while the disease is still spreading in tropical countries. So what is not effective in preventive community spread? Let's start with from basics. No studies have shown, no country in fact, shown that little or no benefit from district, state, or countrywide lockdown or curfew. Basically, the benefit is almost near zero. Harm from such inappropriate, harsh military-like actions are far outweighed than any minor benefits. It is, in fact, it's estimated that in these countries where this the lockdown or curfews continued, for each person die from PCR diagnosed COVID, there will be over 1,000 community deaths due to curfew alone in due course. In fact, the next slide summarizes some of these reasons, not all. These include the lack of access to essential medications and disease complications, inability to get timely medical attention, postponed surgeries, complications, starvations, isolation of the elderly and disabled, psychological stress and neglect, illegal alcohol abuse, brutalities and murders, marked increase of severe depression and post-traumatic stress disorders, etc. Now, these are very important, and this, I don't have time to go through. Each and every item is really worth to discuss and see how one could prevent. And lastly, but not least, the cumulative psychological stress, social isolation, and associated economic failure to support families, because the loss of livelihood of 60% of adults in the country due to curfew is leading to peaks of suicide. Some of them are yet to come. So, excess community deaths due to curfew must be included in death statistics. In fact, I'm very pleased to see that actually now 3 countries had included these statistics about a week ago quite correctly. That has almost doubled, or in fact, one country has gone up by 8 times. They are added their statistic to number of deaths they had reported before. Because it makes common sense. People dying from curfew, it is related to COVID and should be included as a COVID deaths. By doing so, for example, as of today, the death related to COVID in Sri Lanka is likely to be exceeding 10,000. And in India, it's close to 500,000, according to statistics. So COVID-19 is not a nighttime disease or obeying curfew. It doesn't know what curfew is. So the longer term clinical, social, and economical outcomes would have much, much better without curfews or lockdown in cities and states. It most certainly causes much more harm than little benefit it may have cured. The low prevalence of COVID-19 and the low death rates reported are simply due to the logistical and natural reasons, especially warm weather and dry weather. So the humid weather, which actually COVID virus does not last that long. So thanks to summer-like weather in tropical countries, that's the #1 reason that the low number of statistics of COVID as well as the deaths. And certainly not due to draconian measures such as months-long curfews or any intervention, healthcare intervention or delivery. So what is not effective in preventing community spread? That's another myth I'm going to explain a little bit. Up to 60-fold different. There's up to 60-fold differences existing between the number of hospitals and the ICU beds per capita, GDP, or number of doctors per 1,000 population, whatever the measure you use in South Asian countries. For example, from Bangladesh versus Singapore. All these things are more than 60-fold different between these 2 countries. So Sri Lanka and India comes in between. So irrespective of what healthcare benchmark use, as I mentioned before, the reported death rates, which is the number of deaths divided by the COVID-19 positive cases, expressed as a percentage, that's the death rates, are uniformly low and little difference between mentioned tropical countries. So it has nothing to do with the availability of healthcare or the lockdown or curfew. This is simply they are lucky to have the nice weather that is against the COVID spread. In USA, each state utilizes different approaches, at times implementing contradictory policies. So that's a big problem for that country. Many are unfortunately designed to discredit the current federal administration and geared for November election. So it's a political motive for exaggerating deaths and the incidences in that country. It is pity that not putting the country first before politics, and that should not be the case of any country in the world. So basically, the low prevalence of COVID and associated deaths rates are reported in the tropical countries are due to two reasons. One is a logistical and natural reasons, such as warm and humid weather, and less prevalence of vitamin D deficiency. I think this is the number one reason why these tropical countries, including Sri Lanka, had such a low number of infections and deaths. Secondly, markedly less number of diagnoses done. In fact, we are doing the 5% of the number of tests we are supposed to do in comparison with the our neighboring countries like South Korea, Japan, Australia, and other countries. We do only 5%, which is about 2,000 tests a day, and which is highly insufficient. So compared to northeastern countries like Europe, North America, Australia, Japan, etc., we are doing only 5% of PCR testing, not only in Sri Lanka, but in most other tropical countries, either emerging economies or developing countries. If you do not do testing, and you will not diagnose. So the low reported prevalence of deaths in part due to less diagnosis is done using PCR testing. Even in hospital, large number of people with the disease are not diagnosed according to the sources, and those who are died in hospital and community are not included because no COVID test had been carried out. So therefore, the statistics provided by these tropical countries are really not the reality and could be misleading. The one more important finding over the last 3-4 weeks is the multiple studies in several countries reported that each person diagnosed by PCR testing in hospital setup, there are between 10 and 40 infected people in the community. They do not know that they are infected because they don't have signs or symptoms. What we call is asymptomatic carriers. Again, the principle is without testing, one cannot diagnose it. Countries like India, Sri Lanka, Bangladesh, they do not do any community testing. Therefore, they are missing this 10 to 40 times more number of patients in the community, and they're not included in the COVID-19 statistics. So in our opinion, the one need to multiply by the reported prevalence number, that is the number of cases in a given country, on average by 25. 25 is average between 10 and 40, which takes 25 to obtain a realistic figure. In the case of India, so we estimate that affected people getting closer to 2 million. And in Sri Lanka, it should be about 25,000 people affected but not diagnosed. So what are the effective ways of preventing community infection and severity of COVID-19? So we proposed some time back, almost 7 weeks ago to the authorities, that immunity can be boosted at a cost of 10 cents US dollar per person. That is about 20 Sri Lankan rupees per person. We could have achieved this within 3-week period. Everyone above 14 years would have been naturally developed the high immunity at a cost of 1.5 million US dollars, actually approximately 15 million people in Sri Lanka, just for example. So this is less than the third of loss of revenue on one day due to COVID. So this is nothing. Drop in the bucket spending 1.5 million US dollars when each day countries losing several million US dollars worth of economy. So we could have prevented the total loss of economy by taking approach such as boosting the economy with such a globally in every adult in this country by such a small amount of cost. So if we did that in March, for example, there was no reason to have curfews except for temporary travel restriction in small city limit in a very limited capacity. So I'm going to skip these two slides. Always you can go back and read these things. Where we come up with another mode of approaching what you call the sunshine water, where the person can be immunized at a cost of about 10 to 20 rupees or less for a 3 months period. So let me summarize my last 3 or 4 slides, the part 11. Avoiding getting COVID-19. So participating in gathering is not a good thing even now, although the restrictions are over. In my estimate, there's another peak is coming in mid-June. So everyone need to take appropriate precaution and do not relax your respiratory and hygienic things that you learned over the last few weeks, and please continue to do so for the next several months to come. Exposed to daily sunlight and maintaining your serum 25-hydroxy vitamin D concentration above 40 nanogram/ml is the most effective way of prevention of complication from curfew. These can be achieved by the direct exposure to sunlight or by oral supplementation. And one word for the airliners, and also actually apply to large buildings, hospitals, and all these kind of commercial entities, which is to install the HEPA air filtration system. This is actually the filter on all air flight, office buildings, and hospitals that removes in excess of 99.9% of the viral and other bacterial contaminants, so that preventing is crew as well as the people and the passengers in aircraft, as well as the people working in this office building. It's a little bit expensive with these filters, but I think considering the people's lives, using these the sophisticated filters in all air conditioning system is fully worth investing. In fact, you can follow these IATA, US EPA, and WHO approved filter system. They're all based on the HEPA guidelines on this system. So last 2 slides to give a summary of what we have done or we try to do. 7 weeks ago, we had the proper channel. We proposed to Sri Lankan government to protect those who are entering quarantine centers from getting COVID-19 and to protect all high-risk personnel for COVID-19, such as frontline workers, the military, postal workers, at no cost to the Sri Lankan government, because we were paying the cost in our scientific group. We are providing all the materials and expertise free of charge. However, now so many weeks gone by, to date, no response from the Sri Lankan government in accepting our offer to help the country know its people. So COVID-19 has negatively affected the economy, employment, livelihood, and stock market. Key affected industries include the service sector in general, airlines, energy, oil, automobiles, banking industry, tourism and hotels, supply chain in general, and thus most production lines. It is the time to put the country back to work systematically. Thank you for listening, and please go back to the YouTube channel and revisit the slides, and because you can easily gather more information through that way. Thank you, and we'll have time to questions. Back to the moderator.
Hello? Hello?
Yes,
Hello?
Dr. Hema. Yes, Dr. Hema, I can.
Hello, I'm Hema. A quick question.
Yeah.
Yeah, Hema, we can hear you. Go ahead.
Yeah, a quick question is, what is the type of food, the best type of food for us to take normally? I mean, not when you are a patient or normally, or when you are affected. Is there any kind of special food that one should take? Thank you.
Thank you for the interesting question, because it's really had the in-depth meaning to that one. So the Asian countries in particular, including Sri Lanka and India, we had a very, very traditional dietary system where we had a balanced diet over the many decades or centuries, for example. Unfortunately, due to the alienation through the TV and radio and all this commercial advertising, even in villages, people stop taking this so-called natural balanced diet and rely on the starch and all the other junk food as well as uh, sold in the market. So we lost that opportunity to maintain the balanced diet, which provided all the vitamins which I mentioned in my lecture as well, and particularly the micronutrients, vitamin K, vitamin D, and
Sorry?
selenium, zinc, and all this stuff. So if the one step is to go back to the home garden and restart our natural, well-balanced diet. Secondly, to try and minimize the eating outs and all the junk food and get the normal, sensible diets you and everybody else were used to 2-3 decades ago. So, in addition, to answer your question, when you are in general circumstances, the absorption and the ability of the skin to generate vitamin D in the elderly, when you're getting older, become less and less. Therefore, many of these people like us going to need some supplementation when appropriately, which can be taken very effectively and economically, taking simple multivitamin or something very basic thing produced by 10 to 20, 30 micronutrient at the same time. So basically, I'm suggesting kind of shortcut to overcome the nutritional deficiencies. And what matters is not the macronutrient deficiency like carbohydrate, protein, and fat, but the micronutrient deficiencies. Thank you, Dr. Hema.
Okay, my dear. Thank you.
I guess the moderator should have some questions. Ashley, do you have some questions?
Thank you very much, Professor. No, basically, I found it very interesting. It's just that one of the problems that we have is that we are fairly. I don't want to go into politics, but we have a dearth in trying to accept good ideas. So that's an issue. So I don't think you should get too disappointed with that. But hopefully, when we hoist our things properly, maybe what you've been saying all this time would have some sort of truth in it and some effect, which I think is very important. I must apologize for the delay. In fact, about 3 hours ago, somebody hacked into my computer and the whole thing went dead. So I've been trying to get back into the system, but it's so difficult anyway. So I am this Anuradha helped me to get onto this as it stands at the moment. I think I'm not sure whether you want to take any more questions.
No, I'm happy to answer question if there are any. No issue.
Are there any more questions from anyone?
I wrote one question.
Can you announce it?
Yeah, I just asked whether UK is taking the correct measures now.
Okay.
It's a good question, but UK has taken a completely different path of action initially, because it relied on the modeling of Imperial College modeling, for example, which unfortunately completely failed model. So that was the reason why UK had such a hard time for the first couple of months to control. And secondly, it was advised by some group of people to let people get infected so that they will reach the herd immunity quicker so that they can overcome the whole scenario, which unfortunately didn't happen and is not going to happen. So I don't know whether, let me explain what is herd immunity is, because people may not know. Herd immunity is when there is a common infection like COVID spreading through a country over months or sometimes over years, and when the 60 to 70% of the country's people get affected, the viruses start run short of people to reinfect. So with that happened, the infection actually naturally dies down when they reach about 70% mark. So it can happen with the COVID, but it might take a year, maybe even longer. Except in some states like the US, there seems to be getting about the 30 to 40% range of antibody testing positive in the communities, like in New York City, for example. Again, it's so crowded in New York City. There are millions of people living in such a small area. That's why there's so many deaths and things occurred there. So the other side of the story is people are getting immune, as therefore, hopefully, herd immunity might occur. The negative side of the story is that this so-called immunity is unlikely to last more than a year. So if you get another episode in about 2 years down the lane, same people might get infected again. So that's danger still there. Thirdly, already there are about 8 to 10 different strains of COVID-19. So we do not know even the vaccine come up with the one strain, like the Oxford vaccine or USA vaccine, I don't care what. It may not protect the remaining 7 or 8 strain infecting you. We don't know that. That's a possibility by looking at the influenza, for example. Every year, it changes the strain. So people, these experts predict that next year, these are the strain going to come, and they produce a vaccine against those strains. And most of the time, unfortunately, experts are wrong.
Yeah, and also I like to say that UK doesn't believe in hydroxychloroquine, but they say they have some faith in remdesivir or some medicine you mentioned, starting with R.
Yeah, but unfortunately, it's a part of the big pharma and the powerful corporation running the show and misleading the government and the public, because I don't think any antiviral agent will be more effective than hydroxychloroquine, which is exceptionally cheap, and all the antiviral agents are about 1,000 times more expensive than the chloroquine. For the companies, they cannot sell hydroxychloroquine and make money, but they can sell even one vial of antiviral and make the money. So there is a conflict of interest from the companies. So as investors and the very, very powerful and wealthy people are investing in these companies, and they're pushing the governments, especially the US and UK, and so, including Germany, to propagate the vaccine theory, which I don't think is going to even manifest properly.
Okay.
Good question.
You, Professor.
Good question.
Thank you.
Professor, if I can just come back to you again,
Sure.
actually, basically, there's this huge hype that people should be fair, and various creams and all are coming into the markets and so on that people are using extensively, which means that they're not going into the sun at all. Now, you spoke a lot about the need for vitamin D in our systems as an immunizing agent. Now, do you think these people are exposing themselves to virus?
Ash, I couldn't catch it. The exposure virus due to what? Apply the cream?
No. Now, there is this huge hype that people should be fair, no?
Oh, I
And
see. Yeah. Okay, I see that.
on these whitening creams, and people refuse to go in the sun thinking that they will get dark and so on. And you spoke a lot about vitamin D, the need for vitamin D in the system. Now, do you think this trend is going to expose them to these type of viruses?
So let me ask a different way. The people should be proud of themselves being dark or the darker color in the skin. They should not be the other way. I don't know whether you know that historically we were all dark black, pitch black people when it started. Humans generated in Central Africa. So what happened was when they started migrating north because they ran short of food in Central Africa, the batches of people, different direction, they start migrating north towards the Europe. So this happened over a number of generations. So when they reach the colder climate, people with the dark skin could not survive because the infection rate went so high and the reproduction became near zero in the absence of vitamin D. So darker people moved to north, they disappeared, and the people who mutate their melanin gene became white skin, had a tremendous survival advantage living in the colder and climate in the northern climate. That's how the white race began historically. So there's no reason for the darker people to be ashamed of for being devalued, being the darker skin. They should be proud of it. That's where the human being. Now, these skin whitening creams are with a whole load of nonsense and gimmicks. In fact, there are some evidence show that actually it can damage the skin and may even cause skin cancer in years to come. So they may pay money and asking for trouble for the future. So skin beauty is not the way to live a healthier life. So you need to look at the healthy, healthful, and free stuff coming from the sunshine and get that. And
Right.
staying in sunshine for 30, 40 minutes does not make you dark.
Right. No, that's great. We can take about 2 more questions if there's anybody with a question. Hello? You are still there, right?
I see that some doctors are in the call. They can ask me questions too.
Yeah, everybody, I think they're quite stunned with your talk, so they're recovering. So I think that's basically what it is, because well, you laid low all the theories that we've listened to up to now and come up with something which is very simple and 1,000 times more effective, and so on and so forth. So I think
The problem is actually the people does not like the simple solution. They only look for complicated, expensive,
absolutely.
hi-fi solution.
Absolutely.
And sometimes they are useful, but most of the time the simple, straightforward solution are the way to go. But they may not be fancy.
That's right. No, exactly. Now Hema asked about food, and I remember those days. My mother talking about heaty food and cooling food, and you should sort of balance the food diet so that you have cooling items and heaty items and so on and so forth. Or you don't eat only heat food which is regarded to be heaty and so on and so forth. I mean, there were simple rules that people followed. They were not expensive to do, but it was something that was very effective. But today we eat everything together. The heaty stuff, the not heaty stuff, everything is lumped together and we eat them, especially in these buffets and so on in hotels, which is really terrible. So I think we have to rethink our whole lifestyle and where we are going in the future and so on and so forth. So I think your talk was extremely important, and also, I mean, it opened a lot of eyes, I think, to what the future could stand for us, and the fact that the coronavirus is not going away. It's going to be with us for some time, and it can recur, and so on and so forth. So I think we have to get ready for that and see how we can go from there. I think this is very, very important.
Right. Regarding the recurrence, I think the whole evidence suggests that corona will going to be like an influenza, like a headache. Every year it will come back, but at a much less virulency. So it become yet another influenza will be added to the story. So whether to get a vaccination against that is debating. I'm not fancy of vaccine because I've seen enough problems with the vaccine. Oh, by the way, I had a slide which I forgot to show you. Somebody said it didn't come. Let me address that thing because I don't know whether you are aware that in United States, there were several lawsuits back in late 1970s against companies who were making vaccine because there are so many problems with the kids. I'm not saying that there were no problem or whatever, but
Yeah.
based on that, companies cut down their vaccination program quite a bit. So government that time was very scared that the communicable disease might come back, and they saw that the statistics of people getting covered with the immunization went down over three years in a row. On top of that, these industries who are making the vaccines, my understanding is spent something like $5 to $6 billion of lobbying money, which is an indirect way of saying that it's a bribery, to persuade the government to come up with something to protect them. So in 1986, the Congress, US Congress came up with the legislation, first time in anywhere in the world, and certainly in the US history, to protect indemnities, to protect the companies against the lawsuits of any kind due to vaccine. So all the drugs and devices are from companies, something goes wrong, companies can be sued. Guess what? Not for vaccine. So they are specifically protected. That's why how with the making every company is spending $1 billion, assuming that they can make $1 trillion profit within the next couple of years.
Right.
At the taxpayers' money.
Right.
And they are protected.
Are there any more questions?
I'll ask one more question.
Sure,
when will air travel be safe?
Sorry, can you repeat that slowly, please?
When will air travel be safe?
Oh, it's a fairly straightforward question. It's based on the people taking their responsibilities, and the sick people should not travel. But unfortunately, you see them, and the people are coughing, sneezing. They're still getting into the plane. There should be a system developed worldwide. People with sickness to not to travel the day or day before the travel without any penalties from the airline. The people get into the plane 90% because they don't get. They had to rebook the ticket and they had to give the penalties. So the IATA should mandate the worldwide ban of these penalties for cancellation or postponing the travel. That's the number one thing to do, because then the sick people will be glad to stay at home and travel the week later, 2 weeks later, without infecting everybody else. It happened all the time. That's the first thing. Secondly, I showed the one slide towards the end. Every passenger airline must implement the HEPA filters in their system. So because that will filter all 99.9% of all viruses and bacteria, and thereby protecting not only the aircrew, but also every passenger in the aircraft. Even there's somebody coughing and liberating viruses, when they get into the air system, filters will prevent it. Right now, nothing will prevent it, just household filters, they are used a little bit better than that. So that will not prevent the filtering the virus particles. So that's the second thing. Third thing, that there should be a guideline of the booking system and the getting into the aircraft also, not simply checking the temperature, but there should be other means of preventing the sick passengers getting in and turning them back. And finally, which I already advised for a couple of other instances, to have the airline, give the airline the responsibilities to contact the passengers 48 hours before they travel routinely to assure that their health is good. If they say that some have this and this, advise them to stay there for longer and arrange them to change their flight free of charge. So if you do these three things, I think we can make the airline travel safer tomorrow.
Thanks. That's a good suggestion. Airlines should take it up.
I have some more. I don't know to complicate it. Good question, please ask.
If there are no more questions, maybe conclude this session, Doctor. Is that okay?
Well, you are the boss, moderator. I'm working with you.
No, basically, I must thank you very much for the time spent in trying to get this talk together, uh, giving us the opportunity of listening to this enlightened view of what we should be doing and should not be doing. And the Royal Asiatic Society is extremely grateful to you for accepting our invitation and speaking to us today. This program would be on YouTube, which means that it will be accessible to a lot more people in the future as well. Thank you very much, Doctor. Good night.
Thank you for inviting us. Thank you for everybody for participating. And also go and visit our YouTube channel on Sunil Vimalawan's Staying Healthy. There are about 60 brief videos, and I'm going to put some more as things changes. Please subscribe to it and listen to it and make some positive, constructive comments. Thank you for participating.
Thank you, Doctor.